morning, and we are Destination Pegylation, respiratory delivery of pegylated oncolytic viruses.
So the problem we have identified is lung cancer, one of the most destructive afflictions in the United States. There's a 20% cancer survival rate, and 150,000 people die of it annually in the U.S. There are non-invasive methods of treatment that exist, but these methods are subject to quick degradation in the blood. Most methods of treatment are invasive and can include chemotherapy, radiation therapy, and direct surgical removal of a tumor. These methods can have a significant detrimental impact on people's lives and can result in the development of secondary cancers, infertility, and a weakened immune system. So I know many of you probably have experience with some cancer. I know my experience came when I visited my friend's house, and I could not go inside because her mother was undergoing chemotherapy, and I could have potentially brought in a harmful pathogen. So our goal is all about trying to get around having to use these destructive methods of treatment.
One non-invasive approach that has been used in the past is called immunotherapy utilizing oncolytic viruses. These viruses target out cancer cells in the body, forcibly causing the burst or lyse, and release their specific particles into the bloodstream. The immune system then picks these up and can target the tumor cells throughout the body and can target metastatic sites as well. This is why it is so especially cool. What has been used in the past is the herpes virus, a modified form of the herpes virus called Telemogema herpes, or TVEC for short, to treat melanomas or skin cancers. It has been modified so that the incubation time in the body is decreased, the glycoproteins on the surface are increased, increasing the immune response and recognition, and was very, very effective. However, it has only been used with melanomas in the past because once the virus is subjected to the fluid immune system, it is easily washed out of the body very quickly. To circumvent this, we plan to put a polymer shield around the virus of polyethylene glycol, or PEG for short.
Pegylation of TVEC increases circulation time in the blood. This occurs because the PEG polymers mask the virus and prevent recognition by phagocytes and herpes antigens. Additionally, the PEG polymers increase the radius of the virus and decrease the likelihood that it's filtered out of the blood by the kidneys. Pegylation has to be monodispersed or limited to one PEG polymer per binding site to preserve drug function. To ensure this happens, we modify the PEG polymers to bind with specific amino acids on the outside of the virus. As we mentioned previously, TVEC has been used to treat skin cancers such as melanoma that are easily injectable. But the problem that we faced is how do we deliver our virus to a sensitive cartilage area like the lungs? To solve this, we turn to dry powder inhalation. This involves encapsulating the virus in a single lipid bilayer or liposome and freeze-drying it. This offers greater protection of viral structure during inhalation than traditional solutions used in nebulizers. And by adding a common alveolar compound, we can increase the likelihood that the virus binds with the lungs quickly and releases the virus.
TVEC, pegylation, and inhalation can all solve their own standalone problems, but when combined in this novel manner, can form the first pegylated oncolytic viral cancer treatment, and therefore it can be very significant for the way that we treat cancer. So I already talked about some of the advantages it has over traditional methods, but I also want to emphasize the ease in which our treatment can be administered. Because you only have to place a mask over somebody's face, our treatment can be very easily integrated into hospitals nationwide.
To begin our research, we will be ordering the commercially available oncolytic virus from a pharmaceutical company, and then we'll perform pegylation in our lab by covalently bonding the PEG polymers to the surface proteins of our virus. To test the effectiveness of the pegylated oncolytic virus, we will be using mice models, and specifically they will be genetically mutated to favor the growth of lung cancer. The way this works is that we will be taking, in the bottom left picture, you see a mouse embryo. So we'll be taking stem cells from that embryo, mutating them through a process called homologous recombination, in which we use a vector to target a specific gene of interest and mutate it. And then we will take those mutated stem cells, inject them back into the embryo, and that embryo will grow into a mouse containing the derived mutations of interest. The genes that we want to look at and target include the TP53 genes and the CRAS genes, both of which are active in cell signaling processes and anti-tumor processes. And by mutating them, we are able to greatly favor the growth of lung cancer in our mice models. To test the effectiveness, or to apply the oncolytic viruses to our mice models, we will be using inhalatory techniques.
Because inhalatory technologies typically used on humans are too large to be used on our mouse models, we will be using the recently developed respiratory phase masks, or RFM, which are specifically designed for the use of mice. The RFM, as seen in this photo, is composed of two parts: the respiratory mask, in which the TVEC will be administered directly to the lung, as well as the neck fixator, in which will keep the mouse in place during this process.
To track the tumor growth and inhibition, we will be using micro-CT scans, which are basically CT scans but on a much smaller scale. And the way these work is that they use X-rays to produce cross-sectional images of the mouse. And so by using this, we can track how big the tumor is in relation to surrounding tissues.
As previously mentioned, we will be using cross-sectional images to generate finer CT scans of our mice to detect the tumor growth. In some situations, we will not be able to detect cancer masses due to low contrast, and as a result, we will then inject the cells with an iodine-based tracker, which will allow us to detect the different types of tissues. We expect from these results that the tumor size will decrease and that all metastatic sites throughout the entire body will be targeted. We will also be using flow cytometry, which will help us to allow that the tumor is degrading due to the virus and not just due to some random chance. We will be fluorescently tagging antigen-specific B cells and perform lung biopsies on the mice. We will then put the cells through the flow cytometer in a single-cell streamline and use a laser apparatus to pick up the fluorescent tags attached to the B cells. We hope from these results that there will be an increase in the amount of B cells as a result of the TVEC being inserted into the body. And because of this, the immune system should detect and degrade the virus, the pulmonary tumor, and all metastatic sites.
As in any scientific study, there is the potential for problems to arise in our research. First of all, the respiratory face mask has been shown to release small amounts of the substance being administered into the esophagus of the mouse. While this is not ideal, it should not cause great issues with our experimentation due to the shielding nature of pegylation. Furthermore, immunotherapy elicits some side effects, including fever, nausea, chills, and fatigue. Compared to the severe symptoms elicited by chemotherapy and the long recovery period required after surgical procedures, however, these side effects are much less severe. Finally, any cancer treatment has the potential to trigger tumor lysis syndrome. This occurs when a large amount of cancer cells are targeted in the beginning of treatment and lyse their contents into the bloodstream. This may cause complications such as seizures and acute kidney injury. But as long as the patient is monitored in the beginning of the treatment, they should be okay. Moving forward, our research opens the door to using immunotherapy against a variety of different cancers. This is because oncolytic viruses are not tissue-specific, so our pegylated TVEC can be used against liver cancer, breast cancer, pancreatic cancer, and more. In another direction, our proposed respiratory techniques could be used against a variety of different lung diseases.
Viral therapy is a ripe, underexplored avenue of cancer treatment. This research works to enable people to live their lives while battling cancer instead of relegating them to isolated patients fearful of dangerous side effects, like the mother of Dante's friend. We can do better. We should do better, and we will do better. We are the KangCohort.